From the time we were little kids, our parents stressed the need for good dental care. I know mine sure did. As we age, it becomes our responsibility to take charge of our dental care. Are you ready to accept this role? I saw in the survey that many of you are, because many of you have seen the dentist in the past 6 months. That is good because it is recommended that you see the dentist at least twice a year. At our age, we can think that we are invincible, that nothing can touch us. Unfortunately, we are not. You're all familiar with cavities, but did you know that these small imperfections in your teeth can affect different parts of your body? I want to talk to you today about problems that can occur when you don't take care of your teeth and how to avoid other serious problems. Without basic understanding of the importance of dental care, gum disease can kill more than just our smile. In each of our mouths, there is a soft bacteria that forms called plaque. So you can see here, it's soft white. Plaque forms in our mouths even if we don't eat or drink anything. It is very toxic and irritating to our gums. If we do not get rid of it, it can form an infection called gingivitis. This is more plaque. Gingivitis is characterized by red, puffy gums, extremely painful, and more blood going to the gums. I'm sure we've all experienced some gingivitis while we've brushed or flossed our teeth, and it's common. But it's not as serious as it could be. In our age group, there is a more serious infection known as ANUG, or acute necrotizing ulcerative gingivitis, also known as trench mouth. It is characterized as extremely painful, puffy, with more blood going to the gums. The gums bleed when touched and are covered with a gray, slimy film, as you can see up there, possibly. It's dead and it's disgusting. These pictures gross me out a lot. ANUG. A foul odor usually occurs, and it is also accompanied by headaches, a low fever, and an inability to eat due to the extreme pain and bleeding of the gums. Something can also occur called cratering, where the gums do not go in between the teeth down at the bottom. They deteriorate up at the top and form craters. That's not good, and that's a very serious problem. Something else that happens in our teeth. The mineral plaque is not limited to just our mouths. It can mix with the minerals in our saliva and form a hardened deposit called tartar, which forms on our teeth like barnacles on a buoy or on a snail. That's tartar down there on our teeth. It is also known as calculus, and it's just as hard as the math. If the tartar gets into our bloodstreams, it can be very dangerous. It can mix with the minerals in our saliva. No, it can get into our bloodstream through cuts in our mouths and affect very different parts of our bodies. Something else that can occur is periodontitis. It's when the gum line retracts. This is caused when the body tries to defend itself by eliminating the bones that connect the teeth to the jaw. As you can see, the gum line starts to recede, and you can see more and more of the teeth. It's very not good and caused by plaque buildup, you can see. It can lead to tooth loss. Some of the effects of gum disease are stroke. Now, when it goes through the bloodstream, it can cause very serious health effects, such as stroke, heart disease, pneumonia, increased risk of pancreatic cancer, diabetes, preterm birth, and low birth weight babies. As we turn into our 20s and stuff, if we bring our teenage apathy with us, it will have very serious health effects on us. We need to be thorough and diligent in our healthcare. As we become more informed and cautious of our healthcare, we will decrease our risk of we will decrease our risk of future problems. This is the hours for the health center, as you can see. My mother has been a dental hygienist for over 20 years, and she's told me many stories about children, about people in their early 20s whose teeth are in very sad shape. As we become older and move into the real world, we are no longer under the protection of our parents' dental plan, and we must be aware of this. We can't let our teeth go to waste, because they're very important and they reflect on your personality and how you respect yourself. We can petition you need to keep up with your dental care. And you can petition the Health Services Department here at Rider University to offer dental screenings and pass out and disseminate more information, because as of now, they offer no such information. I have some pamphlets here for you. As we move out, we need to be conscious of it, and you need to make sure you keep your teeth in good care. Keep smiling. Thank you.